that has changed. So early on, it was like, how do we get the data, and how do we fill in the gaps, when it's missing? What do we do with that information? Whereas now, when you have so much information, it's what's important. Because if you get sick and you go to your physician, they have, maybe 10 minutes if you're lucky. And they're overwhelmed with the amount of information.
Welcome to Embracing Digital Transformation, where we investigate effective change leveraging people, process, and technology. This is Darren Pulsford, Chief Solution Architect, author, and most importantly, your host. On today's episode, Embracing Generative AI in Medical Research, with co-founder of Astenda Solutions, RJ Kedziora. RJ, welcome to the show.
Thanks for having me. Looking forward to the conversation.
Yeah, this is really interesting. When we first talked, I said, "Hey, this is an interesting spin on generative AI, and in the medical field." But before we get started on that, RJ, every superhero has a background story. What's your background story?
I'd love to think I aspire to be that superhero, but I got started, fortunately, at a very early age with computers and technology, back in the early 80s, and comp sci degree, came up through the software development programming ranks, but realized really early on that software development is much more about people, processes, than it is about the actual technology. Technology is important, don't get me wrong, but it is really about those peoples and processes. And, through that journey of discovery, I worked on railroad car scheduling systems, accounting systems, inventory management systems, all sorts of fields. And they were interesting, but then I got into pharmaceuticals and the medical world. And I just had this realization I could make so much more of a difference in the world working on those technologies. And yes, it's great to know and understand how many cogs are sitting on the shelf and how many products you've sold. Very important. But to be able to help people with their health and wellness kind of thing, it gives you that warm and fuzzy feeling. So I started, my current company, Astenda Solutions, in 2003 with a good friend, Drew Lewis, and we've been going for a little over 20 years now, making an impact in the world, which we thoroughly enjoy.
That's awesome. So, I started in medical imaging, my career. Right out of college, I wanted to be a biomedical engineer. They didn't have a degree at my college. So I went all crazy I have so many minors, it's not even funny. And then I got into I got into medical imaging. And yeah, I felt really accomplished doing that because we were actually helping people. Mm-hmm. And then I chased the .com, brass ring around the Silicon Valley for too long, and I lost my way. So maybe I should get back into medical somehow. But tell me specifically what area you were looking at in helping people. Were you doing like electronic records? Health records, or like me, were you doing radiography or any radiology, anything like that, or where did you focus?
It's a combination of things, and what's interesting about my career trajectory too is when I was in college, I was gonna go off and get a PhD in AI, and then I got that job offer, and I was like, more debt or go out in the world and make a living, and I made a living.
Yeah, I know the feeling.
But I've always played in the world of AI and generated those expert systems. And people sort of forget that AI has been around for a long time. But Astenda got started. We were fortunate. My partner, Drew Lewis, knew a number of people at the Joslin Diabetes Center, one of the premier institutes in the world of diabetes and care and treatment and research. They were part of a congressional grant for the development of a diabetes disease management solution. And we got to work with some of the top tier experts in diabetes and endocrinology, which is the specialty that treats people with diabetes, at Walter Reed Army Medical Center in Washington, D.C., the Boston VA, the Indian Health Services, who we still work with today. So the technology that we helped develop got started around the idea of identifying incidents of diabetic retinopathy. And that's the leading cause of preventable blindness. So if we can find it,
Then
then
you can
we can
save
help
people's
treat
sight.
that
That's
patient. Yes.
incredible.
That
Yeah.
program within the Indian Health Services today is called the Joslin Vision Network, is still running. Over 100 cameras are deployed throughout the United States now, and we've acquired millions and millions of images over that time, over these last 20 years. So we've been doing, research related with that into AI and machine learning algorithms. But then back then in the early 2000s was sort of the dawn of digital health, before it was even called digital health. It was like, how do we use the power of technology and systems to make a difference? At the time in the early 2000s, most organizations in the healthcare world were still paper based. So trying to get that information into a digital format was very difficult. We were fortunate to work with, these government agencies that did have electronic medical records. So we got started very early on with digital data. And back then, 20 odd years ago, it was still about, okay, how do we get this information and what's missing? How do we bring together all of these different components of information and drive, interesting facts out of that to help make decisions? So at that point, is still in terms of diabetes and understanding your blood glucose, very much finger stick technology. With people don't like doing it. It does hurt. You typically don't do it more than once or twice a day. Depending on your condition, you should do it a lot more. But now, fast forward 20 years, there is a lot more data. So whereas before it was trying to make sense of limited information, now we're trying to make sense of overwhelming amounts of information. As you have continuous glucose meters, which generate a value as frequently as every minute. You have all the data from the electronic medical record system. And then with the advent of mobile applications and technologies, what's going on just in your life? What are you eating? What are your exercise patterns? What are your sleep patterns? And how can we provide better evidence and ideas of how to improve your life?
So with all this proliferation of data, have your algorithms changed much, or now the algorithms can just do a lot more? Or has even your approach changed to a solution to the problem, right? Because before you said you had limited data, so but that gave you time to hone your algorithms, hone, you know, what to do with the data. Now, are you overwhelmed? I guess is my question. Are you overwhelmed with how much data and how many different types of data? And has it changed the fundamentals of your algorithms and your data processing?
Mm-hmm. Yes, to all of the above. So much has changed over the 20 years. What's interesting about Estenda, we are foremost a professional services organization. So we do help a number of clients develop tools and technologies beyond diabetes as well, to make better decisions. Very much always patient focused in that area. So either directly to an individual or to a healthcare provider to help make those decisions on care and treatment. If I think about it, I don't think we've ever done anything on the billing side. Just haven't found that very interesting. So very much on the patient side. But yes, that has changed. So early on, it was like, how do we get the data? And how do we fill in the gaps? When it's missing. What do we do with that information? Whereas now, when you have so much information, it's what's important. Because if you get sick and you go to your physician, they have, maybe 10 minutes if you're lucky. And they're overwhelmed with the amount of information and they can only do so much.
Wow, that's really fascinating because that completely changes, right? Especially for the caregiver as well. Before, a caregiver was trying to get information out of the patient, asking, probing questions, all those skills that they learn. Now with all these constant monitoring and things, now it's how do I sift through all the data? So that's fascinating. No one's ever really talked about it that way before. on my show. So
Yeah, it's interesting because like when we got started, and I used to wear heart rate monitors that you would have a strap and like
yeah, I
multiple
remember that.
wires
Yeah.
leads to connect to different places on your body, and then I'd go run and be like, oh, okay, what did my heart rate do? Now you wear an Apple Watch or one of the rings that are available, and it sort of fades in the background, and it's very passive monitoring. You don't think about it very often. There's a number, so a number of these companies with the CGM devices, continuous glucose meters for patients with diabetes, so they can understand their glucose and what's going on and how their body reacts to different
Oh,
foods.
I have some friends that have those glucose monitors on their
Yes,
shoulder, and they'll eat lunch and go, "Oh, look at that," on their
yes,
watch. I'm
absolutely.
like, gosh.
And it's amazing. And now they have devices that they're marketing to people without diabetes. And I actually just wore one of these for the past couple of weeks. Be like, I'm fortunate that I don't have diabetes. And it was like, okay, what can I learn? What can I see from this information? And even though my body operates more normally, it was still very interesting to see the impact of what I know. Because like this is my life. I work in technology. I'm always looking at this data, have a lot of background in this. So, for instance, one of the things, so you eat carbohydrates and your blood sugar goes up. But a very frequent recommendation is after eating dinner, lunch, go for a walk. It will impact your blood glucose profile. And I was able to see that,
Oh,
Friday
interesting.
afternoon, you eat the same thing, don't walk. Saturday afternoon, ate the same thing, went for a walk, and you could see how it impacted your blood glucose profile. And it's just fascinating to see that in the numbers and the graphs and in charts kind of thing. It's like, okay, yeah, I know this, but now here it is in real life.
So how do you help not just with the research but also the clinicians out there? How do you help them sort through all this data?
Mhm.
Because I mean, there's so much data now. What do we do? And like you mentioned, you got to determine what you throw away and what you don't now, right? Where before you were like, I need more data. Now there's too much data. So what do I do?
Yeah. First, it's about finding the patterns. That's in my mind is always the first step. It's like, okay, what is meaningful information here? And when you have diabetes, it's, you can look at the highs and lows, the frequencies of those, how long. Because if you look, at a patient with diabetes, and the standard blood test you get is an A1C, which is an average of your metrics over 3 months, of your blood glucose over 3 months. So think about mathematically how an average works. You can be really controlled very tightly, staying in narrow range, or you could go really high and
Yeah,
really low
it
all day
depends
long.
on the deviation, right?
Right.
On the
And
standard deviations and
yeah,
things like
and
that.
have the same average. So that's not the greatest thing. But now with these CGM devices, we really can see that deviation during the day. And when you go really high, you're not so much feeling it, but you are doing damage to your body. When you go low, you do have the chance of, passing out and actually dying. So you really want to avoid those lows. So we're first looking for those patterns, trying to, I want to identify them. How do you quantify it and be like, okay, how's this person doing? Where are the problems and challenges? But then now we've gotten to the point where we have to go beyond patterns. As I talk to startups and different organizations, kind of thing, particularly in startups, it's like, oh, we're going to get all this data, we're going to identify patterns. Well, that's great. What are you going to do with it? you know,
Yeah,
um,
exactly. Yeah.
and it's like, oh, we're going to help the doctors. We're going to identify these patterns. They don't have the knowledge, the training to know what to do. Well, you just gave them a pattern. What do they need to do? So that's the next evolution of this that we've been working on, is like, okay, now once we've identified the pattern, how do you change their treatment to be able to make them healthier and be better? And we've been doing this in a variety of ways for a while now. Back in the early 2009 through 11, we developed an algorithm with some endocrinologists, medication recommendations kind of thing. So it's like, okay, different medications have different pharmacokinetic profiles, how they interact within the body. So based on that data we're seeing in the patterns from that medical record information, we know what medications have been prescribed. We're sort of making that leap then for the human doctor to be like, okay, are you really taking these medications? And then, okay, that's not working. We can see your blood glucose profile or your blood pressure isn't responding like it should. Okay, let's try this medication, that kind of
Please. So a lot. I've noticed this. I come from a family of doctors. There's a lot of trial and error, right?
Yes.
You make your best guess based off of, all right, I see these patterns. I'm getting suggestions on these treatments will help, right? But then I try it out and the patient either starts getting better or no change or gets worse. It's almost like watching an episode of House MD, right? He almost kills every single patient and then
Yes.
eventually finds out, well, oh, you just need a water pill. That's all.
Yeah, exactly. And that's where I think the AI technology is really coming to the forefront, sort of to bring this to the world of
Okay,
AI.
that's exactly where I was headed.
Yeah. So humans, one, are fallible. We don't have all of the information. We get tired. We get agitated. I get, hangry if I haven't eaten every couple hours kind of thing. It impacts my decision making. There are a large number of medical errors that are made each year in the US. So you have that fact that humans aren't, infallible. We are human. But then the rate of medical knowledge that is generated today,
It's
we can't
incredible.
keep up. So you have these two factors coming to play that the computer, the AI, can deal with this information. So what I'm looking forward to in this world is with EMRs and EMRs by the industry and my fellow technologists out there. We're not really designed for patient care. Doctors, nurses, healthcare professionals hate them. And they're much more about gathering data and for billing purposes.
Yeah, exactly.
So
They're a billing tool.
yeah, and doctors, nurses, they want to care for a patient, not type notes into a computer. So now with AI and generative AI, and a lot of people, you'll see this in your Zoom calls, your Teams calls, whatever technology you use now, but they have note takers. And
Oh
it's
yeah, yeah,
technology
absolutely.
taking notes. So this is becoming a huge use case in the medical field of ambient listening. So the computer, the AI, is listening to what is happening in the room, transcribing those notes. So it's using the power of the technology to allow the doctors, the healthcare professionals to be more human and work with them. And right now, it's really just creating notes and also summarizing the medical record so that it can surface meaningful information to the physician, to the nurses. And I'm looking forward to sort of the intersection of those two things. So as the AI is listening to that conversation between the doctor and the patient, it's aware of that past medical history. It might even be aware, at the time, if you connect all
Oh,
of this stuff
interesting.
up in 10 years, what's going on with their heart rate and blood pressure right there in the room. And then ask questions like, hey, Dr. Jane, may ask the patient this. I sort of want to still keep that human element in there and don't want the AI just like, hey, what about this? Surface that question to the physician to be able to like ask the patient then and gather more meaningful information. It's like, hey, what about this? Kind of thing. So we're not quite there
We're
yet
not
with
okay. Well, and is there going to be a huge element of trust in that? Now, personally, I trust. I would love for my doctor to be trained on how to leverage a Gen AI. I
yes.
absolutely would. But I'm a technologist. I embrace Gen AI. Not a lot of people do. So, at what point do you think we're going to get to the point where we can trust the results coming out of a Gen AI enough, not to go fully on with the Gen AI because I don't want that, but I sure want my doctor leveraging it the best that he can and with his or her knowledge to correct, and use it as a tool instead of as someone pushing them around, like the insurance companies do, for example.
Yes, and the insurance company is definitely sort of a danger, a cautionary note of
Yeah.
what happens there. But I think one Oprah, a couple weeks before we're recording this, Oprah had a special on
Right?
AI.
Yeah, yeah, she did.
I think that is sort of an inflection point. Like when Oprah's talking about something, it's hit the mainstream media. There's a lot of talk of like, is Gen AI overhyped kind of thing. I was like, well, not until
Mm.
Oprah started talking about it. Wasn't quite there. But she very much was like, okay, this is something we have to, be aware of. We should be in awe of it, but we also have to be careful. The trust and transparency, goes hand in hand with that. I think is an interesting conversation because I don't really know how my doctor makes decisions. Is she making the right decision? There's a reason for second opinions. It's like, I don't know if I trust my doctor.
Yeah,
You know,
that's true.
so how do I use the power of that technology? And it's merging together. And I started, and I'm not the only one, but it's not artificial intelligence; it's augmented intelligence.
Augmented intelligence. I really like that term.
That's the key. It's like how do we let the human be more human, but use the power of technology? One of the challenges in AI is bias in that data, but some of that bias came from the human component into it, and we are not good at identifying our own biases.
Well, I think it was in the 90s when heartburn heartburn medicine was outrageous, right? You could get heartburn medicine all the time and ulcers and things like that. And medical knowledge and the bias in the medical community was how to treat that. And then I think it was down in Australia, someone found out, hey, my patient's ulcers and heartburn went away after I treated him with antibiotics for something else. And all of a sudden they came and said, I don't have this anymore. Bingo. All of a sudden the whole industry on how to treat that changed. Oh, someone has that, they've got an issue, in their gut. They need an antibiotic. So that bias has always been there, but we as a society have accepted that bias. Well, most of us have, right? That, hey, that's how you treat. If you have this, that's how you treat it, because that's the knowledge, the work of knowledge that all the medical professions have learned over in medical school and in their continuing education.
Mm-hmm.
So that's an interesting, when you think of that, that's an interesting concept that, oh, we say that Gen AI has bias, but we do too.
We do too, and an
Yeah.
often quoted number is that it takes 17 years for like medical knowledge research to get into common practice.
Oh
I
my
don't know
goodness.
when's the last time anyone actually looked at that, but 17 years is a long time. But when you think about the millions of articles that are generated each year on the
There's no way to
various
keep
journals,
up.
you just can't, even in your field, it's very difficult to pick up, keep up with all of that knowledge and information. And in the world of research, I think of it as a new challenge. So go back 10 years ago, and most journals were very much peer reviewed. Now there's a whole number of journals that are publishing articles that the data is not peer reviewed. And it's acknowledged. It's like, okay, this is, hasn't been peer reviewed to the same degree as like the JAMA, or New England Journal of Medicine, same level of threshold. But that information is out there now. That research is out there now that someone can read and internalize. And it's hard to recognize, like, okay, was this good research? Was it not? And do you internalize that and now make decisions based on that information? You probably do, because it's hard not to.
So
Even though,
that brings up another question, because Gen AI is trained on this data as well.
yes,
So, so this, I mean, this goes into that bias, which is an interesting aspect as well. If the research has not been peer reviewed, it still may be good research, but it's in question. The level of trust is not as high as if it's peer reviewed, would be my guess. So is there a level of, maybe we need Gen AIs that are only trained on trusted data, but then how do we break beyond the bounds of our own research? Because you and I both know this. I just finished my PhD, and my dean said, your dissertation is 98% somebody else and 2% you. He goes, otherwise, it's going to take you too long and it'll be rejected. If it's too far out there, just like Newton with the laws of gravity was too far out there, he was rejected at first, right?
Yeah,
It's
absolutely.
the same issue. So, man, we're in a conundrum. We got a problem.
We do. And that's why the human is still in the middle of that equation. The
Yeah.
best use cases for Gen AI in healthcare now are really more of that administrative back office kind of thing, where it is the ambient listening technology, easy to deploy, easy to generate value of it, summarizing notes, generating correspondence. Time and time again, research is finding that AI generates a letter or communication with a patient that is more empathetic than a physician, which is amazing. It's like, okay, it doesn't have a soul, it doesn't have a heart, it doesn't know what
No,
it's
but
doing. No question of that. It's not conscious, but it can be more empathetic in what it creates. And as I've gone to various conferences and talked to people, it's like, oh, what do you think of Gen AI? And they're like, oh, yeah. I asked a couple questions. I wasn't too impressed. Well, did you take a time to understand and learn the technology and the power of what it can do? Ask it to answer your question like Bill Gates or Bill Murray, and you're going to get two completely different responses. I'm on this path of actually writing my first book, very much early stages kind of thing. So still trying to figure out what exactly it's about, somewhere in the realms of productivity and maximizing value. But as I've talked to the various different development editors that are helping me out in this journey, they're like, don't use ChatGPT. I'm like, because we'll know. I'm like, well, I know how to prompt it to generate a better response than the average person does. And in the back of my head, I'm like, I don't want to use it because I want it to be mine. But you still use it for brainstorming and
well, of course,
and
of
stuff like
course.
that.
Like I'm actually RJ. I'm working on a book as well on my podcast because I get to interview great people like you, and I want to compile it and all this stuff. So I have all the transcripts of all my podcasts already using a Gen AI to do the transcription, and I'm like, I have my outline. I just want to ask Gen AI to go through all my transcripts and say, I'm looking for a story about this. Pull it out, give it to me, and then, So of course I'm going to use Gen AI to help
Mhm.
me write a
Yeah.
book,
That's a
right?
perfect use case for it. You have so much content
Yeah.
through the
How
interviews
do
over
how do I sort
time.
through it? Yeah.
You can't, or else it's going to take you forever. I shouldn't say you can't. It's going to take a long time for you, and that's a key aspect. It's an efficiency thing.
Right.
I
So
use it to generate user interviews. So one of the systems we're helping create is around the smell testing, olfactory smell testing. And I had to interview a PhD in this world, of which was new to me. And it was like, so I input all the parameters and had it generate 10 questions. I could have done that. I've been generating user interviews for dozens of years now, kind of thing. It's something I do, but it takes me a little longer than the technology does, which saved an immense amount of time.
but but you're the subject matter expert.
Yes.
So you take that output it gives you, you made changes to it.
Mm-hmm.
You validated it
Yes.
instead of just sending it over. And this to me goes into the medical research as well. Now, why we still need doctors, why we still need subject matter experts, but now we're augmented. We can move so much faster now. We can be more reliable in what we're doing because we're not bogged down with the minutia of things.
Yeah. It's an 80% solution. But what you just said, I was thinking about this morning, is an interesting challenge we're about to face. So the better use cases for Gen AI are for to essentially emulate people with less education, less knowledge, less experience, kind of thing. So you can sort of think of it as like that intern. Okay. So now I can start using Gen AI to fill those roles and those people. I
Yeah.
don't need 5 interns to do some work. I can use Gen AI. I don't necessarily need the person to write that marketing article kind of thing. I still do because it's that 80% solution. It's like, okay, definitely use ChatGPT. We're much more efficient, but you as the human always have to add that last 20%, add our unique voice to it and everything like that. But as this moves forward, and it does get better and better and better, because this is the worst it's going to be, it's going to get better and better and better. We hit this quandary of like, okay, how do the people that's replacing get the experience to become the subject matter experts to be able to add that extra 20% to the story? It's an interesting.
I actually have brought that up to higher education in some of my consulting and speaking that I've done in higher ed, and it's a huge concern in software development too.
Yeah.
Because I am a software developer by trade, and I can program so much faster with my GenAI buddy, right? That's helping me. And before I would have to train up junior software engineers, and that took time and effort. But now I'm not going to use them because it's so much cheaper to do it over here. Now they're never going to learn how to become a systems architect or things that take time and effort to use. So I agree with you wholeheartedly. I think we're going to coin the phrase Gen AI generated skills gap.
That's exactly it. On the flip side, people said the same thing when calculators were invented. Like, why do we have to teach math anymore? Like, we have a calculator.
You still have to teach math,
but
still
teach math.
Multiplication tables.
So yes, you still have to learn and understand math, and in education they have a lot of challenges, just like medicine does too. It's like, how do you teach now with the idea that these things exist? And it's like when you ask a person to write an essay on Abraham Lincoln, it's going to be really hard to know when that student is using ChatGPT. And talking to educators about this, my daughter just graduated in middle school education degree, kind of like the teachers are seeing this and are aware of it. It's like, well, when that C student all of a sudden turns in an A-level paper, you're like, wait a minute, something's funny here. But if that A-level student then starts using the technology, it's like, can you really? And there are AI detectors out there, but they have a huge rate of false positives, and they're just not
huge rate. Which brings up the back to the medical research. Are we going to embrace generative AI to help us get things done quicker if it's saving lives, or are we going to stall on it because we're concerned about job loss and skill gap generation? That's a big question.
I think two things. One, there was a recent MIT research report that looked at the jobs from 1940 to, I think it was like 2010. And there was something like 80% new types of jobs in 2010. So there was this transition of jobs and from agriculture and farming kind of thing to more technology related. So we're going to see this shift again. I don't think of it as job loss. There's a job shift and change, in that capacity. But do we trust it? Do we not even trust? Do we use it? I think we have to, because there is an obesity crisis. There's a mental health crisis. There are not enough trained professionals. And I heard someone say, we can't birth people fast enough to solve that problem. We have more and more people that are retiring and leaving healthcare. We need to use the power of technology. And that's why I love being in digital health technology, because we can develop the solutions that do scale. It's like N of one, you can do great things. You can help an immense amount of people, but you're one person. And so if we can develop the tools and the technologies to help someone with mental health issues, that it's just, okay, make a copy of the program, put it on their smartphone, and now we're helping another person. So yeah, we have to.
Yeah, I love that approach. RJ, thank you for coming on the show. This has been a great conversation. It's exciting to me especially in the medical field. Like you said, we do have a shortage of doctors, and it's only going to get worse as people age out. So thank you for coming on the show and enlightening me and my audience.
Thank you. It's a great conversation. Appreciate it.
Thank you for listening to Embracing Digital Transformation today. If you enjoyed our podcast, give it 5 stars on your favorite podcasting site or YouTube channel. You can find out more information about Embracing Digital Transformation at embracingdigital.org. Until next time, go out and embrace the digital revolution.